Bore da, chroeso. Welcome everybody and good morning. It's a beautiful day. You can see my bluebell wood behind me, a little early, I'm afraid, but just to remind us all that spring is here and we can be optimistic for the months ahead. Today is also the day on which the socio-economic duty in Wales is due to be implemented. So we hope to have a good meeting. I'd like to welcome everybody and do apologies for absence. So first of all, welcome to any members of the public or the press viewing this meeting, and welcome to board members and representatives from the Community Health Council. I'll introduce participants myself, which is probably easier because it's a virtual meeting. I'm Vivian Harpwood, Chair of Powys Teaching Health Board, and also present is the Vice Chair, Melanie Davis. Independent members here, first of all, welcome to our new independent member, Dr. Robert Lewis. And we also have present the other independent members, Francis Gerard, Ian Phillips, Mark Taylor, Susan Newport, Trish Buchan, Tony Thomas and Matthew Dorrance. The executive team, Carol Shillabeer, our Chief Executive, is present. Hayley Thomas, Deputy Chief Executive and Director of Planning and Performance, who has a really important role in the discussions today. Jamie Marchant, Director of Primary Community Care and Mental Health. Alison Davis, Director of Nursing. Pete Hopgood, Director of Finance. Stuart Bourne, Director of Public Health. Kate Wright, Medical Director. Mark McIntyre, Deputy Director of Workforce and OD, Wayne Tannehill, Assistant Director of Estates and Property, and Lucy Cornish, Assistant Director of Therapies and Health Sciences. We also have Rani Mallison, Board Secretary, Katie Blackburn, Chief Officer of the Community Health Council, Francis Hunt, Chair of the Community Health Council, and colleagues from the corporate governance team who will be supporting this meeting. Apologies have been received from Julie Rolls, Director of Workforce and Organisational Development, and Claire Madsden, Director of Therapies and Health Sciences. I'd like to remind you all that today's meeting is being held during the pre-election period for the Senedd, and we therefore have to be mindful of that. We will not be discussing political issues at this meeting. Please also note that participants may look away from the screen from time to time to check their notes and documents that have been presented for today. So moving to the agenda, which is published on our website along with the papers. As has been the case for much of the time during the pandemic, we have a very focused agenda today. So can I ask whether there are any declarations of interest, please, which have not already been made known to us? No, thank you. And could we then turn to the minutes of the previous meeting held on the 27th of January for your approval? Can I ask you first whether anybody spotted any matters of accuracy that we need to consider? If so, could you please let me know? Yes, thank you.
Sorry, Chair, Jamie Marchant here speaking. Yes. I will put the camera on for this one brief comment. My job title is inaccurate for the January meeting. As you mentioned, Hayley is the Deputy Executive. Oh, yes, I was in November, but not in January. So beyond that, yes, Chair, everything else is accurate from my perspective.
Thank you very much. Yes, all right. I'm sorry about that. It was a sort of hangover from the previous time. Thank you very much.
Thank you, Chair.
Does anybody else have a comment or anything to draw to my attention on accuracy? No, thank you. We do not have anything on our action log, no actions at all, which is very nice. But are there any matters arising from these minutes that anyone would like to draw to our attention? There are a number of pages, in total 11. not too many, so just to take pages 2 and 3, 4 and 5, 6 and 7, 8 and 9, 10 and 11. So I take it that there are no matters arising. Thank you very much. You will also see there a summary of the minutes of the in-committee meeting held on the same day as the board meeting. Those are really just for information. And again, there are no matters arising for us to discuss at this meeting. Thank you. So I'd like to turn now to agenda item 1.7, which is my own report first. A, Chair. Nice to have an A by your name from school days. Just, you will see there that I've written, or with Ronnie's help, a report for your information, and that one of the current concerns, if it could call it that, or issues, which is occupying the chair and will occupy the minds of the independent members, is the issue of board champions. Details are attached in the Welsh circular, which was issued on the 19th of January 2021. We are currently considering the board champion roles in the health board, and it should be noted that there are 3 roles which still need to be confirmed. All of this is under review at present, and we'll report back at a later meeting. The only other thing I would like to mention is that I attended the staff forum, at which we took a moment to reflect that that particular day marked a year since the start of lockdown. It was quite a sad day, and I'd like to remember us all, to remember the people who've suffered so much as a result of this pandemic. But I'd also like to thank our exec team for their very, very hard work throughout this period. If there are any questions from this paper, please ask them. No, thank you very much. So now I will hand over to Mel, the Vice Chair, who's going to give an oral report and update today.
Thank you, Chair. Really just to draw to the board's attention that I've attended both the corporate parenting and the safeguarding committees. They were held as they should have been in the last month. Also, I attended an interview for the Deputy Director of Nursing with Jamie Marchant, and that was successful in the application there. The Startwell Partnership and the Mental Health Planning and Development Partnership also both went ahead, and the Vice Chairs attended a Leonard Morgan's meeting on mental health, and there is a new focus on the mental health agenda. Thank you.
Thank you, Mel. Could I then hand over to Carol Shillabeer, our Chief Executive, who will present her report and will talk a little more about the day we had of remembrance on the 23rd of March at the Staff Forum. Over to you, Carol.
Thank you very much, Chair. Bore da, everyone. Thank you for the opportunity to present a report, and as the Chair's just said, add a few words to the written report that's already been circulated. I will start with the pandemic, if I may, as I have done throughout this last year in my reports, and we are finding ourselves in a position where we are now coming out of the second wave of this pandemic. And a short 12 months ago, who would have imagined that we would have still been in this pandemic at this stage? So marking the 1 year was quite a poignant moment, really, in terms of recognising those friends and family that have been affected by this virus. But also to consider the work of the Health Board and colleagues within the Health Board in association with partners, of course. And I hope some reasons to be optimistic as well about the future. And so my report does pull out a couple of key points. Good progress has been made in relation to non-pharmaceutical measures, so lockdown type restrictions, and now through the well-established vaccination programme. We've seen over the last few weeks the case rates in Powys have fallen significantly from a very high level during December and January. And that is reflective of the rest of Wales, the fall in the rest of Wales as well. But I would say that the case reduction does appear to be plateauing out at this stage, and the easing of the restrictions with schools going back and other activities that get associated with that means that we have to monitor the situation very carefully indeed. We'll touch later on the performance report, where some more of the sort of COVID pandemic related performance is presented, but I would just say that we are continuing to monitor extremely closely outbreaks and also the impact of vaccination. Operational matters continue to be overseen, and at this stage the Health Board is working well in terms of urgent and emergency care, and again a bit later on in the agenda we'll touch on the performance report, and planned and elective care will feature as part of that. So we are a year in. We've got some important items on the agenda today in relation to trying to look forward and hoping that we're moving into a recovery and renewal phase. But I just would add a note of caution in that we, with this pandemic, has had twists and turns, and we can expect perhaps some more of that, particularly with the risk of a third wave, and particularly in terms of planning ahead to winter. But for now, I think we can be optimistic. Just to cover off a couple of other areas in my report, we will be holding a staff recognition event on the 14th of April. This will be the second of our different types of events. We usually have one big event in the summer, of course that couldn't happen last year, so it does give us an opportunity to both celebrate and recognise the efforts of staff across the organisation, and we'd extend an invitation to board members to join us for that. And then there's some welcomes and some thanks as well. I think welcome to Dr. Kate Wright. It's her first meeting here with us as Medical Director. Great to have Kate with us, and she's joined from an Ira Bevan University Health Board, and also to Lucy Cornish, who's the Assistant Director of Therapies and Health Sciences. This is Lucy's first meeting. And then I think Mel mentioned some interviews that she'd been a party to, and congratulations to Marie Davis and to Louise Turner for their appointments. We're delighted that they will be with us. But if I can end that part with a huge thanks to Dr. Paul Buss and to Dr. Catherine Woodward for supporting on an interim basis the Medical Director leadership role on the board, and huge thanks go to them for their support. Chair, you've mentioned the pre-election period, so I won't touch on that. And I won't say too much about performance as well, because we're going to have a separate report on that. But I would want to just draw attention to two things. We have been notified of an improvement notice in relation to hand-arm vibration from the Health and Safety Executive. And whilst that is very disappointing to us, we recognise that some of the historical practices have not been what they were, and we need to provide a greater assurance that we have assessment in the workplace and working practices in place. It's important in terms of transparency to make people aware of that notice. And then finally, some good news, and the board just a few months ago approved the blueprint for the Health and Care Academy. And I just thought it might be useful to update you to say that we have, in partnership with the University of South Wales and other health organisations, been supported by Welsh Government to establish an intensive learning academy focusing particularly on digital transformation. That will form part of our overall Health and Care Academy, but it is a much welcome boost to our approach around learning and development within the county, in partnership with partners around the Regional Partnership Board table as well. And this positive news will mean that it's another step forward in the establishment of the academy itself. And then finally, I wanted to just flag, as you said, Chair, at the start of the meeting, today marks the start of the socio-economic duty, and I know we'll cover some of that a bit later on. But just one example of the things that we will be doing and are doing, and that's that we've had a proposal for a Kickstart programme approved, and that will enable young people, particularly those in more deprived situations, to enter training and employment for a 12-month period with a view to securing longer term job prospects. I'm delighted that as a health board we've been able to establish this programme, and I hope that marks a signal of intent on the organisation's behalf in terms of the socio-economic duty. So thanks very much, Chair. I hope that was helpful and very happy to take any questions.
Thank you, Carol. Are there any questions? No? Well, thank you. We now move on to the next section of the agenda, section 2.1. And Carol, I think you're going to introduce that.
I am.
Please.
I am. Thank you very much, Chair. And I think this carries on from the theme that you presented in your report and that I've just spoken to, which is looking ahead, really. And so this is an overview presentation of the draft annual plan for the Health Board in relation to the year ahead, the year that actually starts tomorrow. This is a plan that is required to be submitted to Welsh Government, but even more importantly is a plan to guide us through the next 12 months. I'll bring other colleagues in shortly, but just to say a couple of key things on this. We're clearly still in the pandemic, and so understandably our focus will be remaining on dealing with those immediate priorities around the pandemic itself. But also I hope this plan helps to set a context now for a recovery and renewal as we move forward. We've done a lot of work over the last couple of months working through understanding the evidence of the impacts of the pandemic, so that our response might be really attuned to that and focusing on those areas where we can have the greatest impact for the greatest need. So hopefully this annual plan will give a guide both to the, in terms of the collective objectives of the board, but also to the organisation and to partners across Powys. So I'm going to hand over now to Hayley, and just before I do, if I can just mention some thanks really to all members of the executive team and their respective teams, but in particular to Sam Ruthenhill, who has been supporting the development of the plan this year, a very different plan to our usual IMTP, so it's been a challenge in that regard, and has been a huge amount of work in quite a short time frame. So thanks to Sam, and I'll just hand over to Hayley now, if that's okay. Thank you, Hayley.
Thank you, Carol. Diolch am y cyfle I gyflwyno y blaenoriaethau strategol yn y cynllun blynyddol. Thank you. Really pleased to provide a summary presentation of the information that's contained within the papers, setting out the approach that we've taken, the evidence base and the draft strategic priorities for recovery for the next year. Carol's already mentioned around the NHS Annual Planning Framework published by Welsh Government in December, and that framework set out the ministerial priorities and the key enablers and expectations within the plan. And whilst we've been developing the local plan, we've been working to ensure that there is alignment between the national framework, and also we've been building on a very strong base of quarterly planning that has been in place during the last year during the pandemic. But it would be fair to say this is a very different annual plan, and the process of developing the plan in the context that we're working within has been challenging because it continues to be a busy operational period. But also it's about looking forward now to the renewal priorities, so I'd be quite keen to cover that in a little bit. In terms of the way in which the plan has been developed, we've had ongoing conversations within the organisation, but also importantly with key partners. We've held sessions with the Community Health Council, we've had sessions with the local authority, and we continue to work through the Regional Partnership Board, the Public Services Board and other committees at a regional and national level. And what we've tried to do in this annual plan is to summarise the contributions across all of that. I'd like to draw the board's attention to the status of this plan. So it is draft and it will be discussed during Q1 with Welsh Government alongside the discussions around the financial planning for next year. So in terms of the approach that we've taken, this slide, I'm trying to see it at the moment, I've lost the slide, so apologies, I'm not sure what's up. We've taken a 6-step approach to planning ahead. So this has been a really useful and clear framework for us where we've gone it step by step through the learning and reflections. And just in terms of this particular piece, there's the attached new ways of working report, but that together with both the staff survey results, also some of the broader learning that we've been able to garner across both NHS Wales and across the UK and internationally has been considered. The learning from digital has been really important for us in considering the content of this plan, and obviously the insights that we've gained both throughout this last year and on a continuous basis with key partners, the Community Health Council and others, when we've been engaging with the public. We've had to take very much clear sort of information around some of those patient insights to inform the learning and reflections as we go into next year. The second step then is around the evidence base and in particular the impact on the population of the pandemic, and there's some key reports contained within the presentation around particularly the COVID impact on both socio-economic factors and the wider harm to our society, but also just picking up the importance of addressing inequalities, and there's continuous work that's been undertaken to look at that and inform across the whole plan our priorities going forward. I would say that in particular the King's Fund disaster recovery model provides a really interesting piece of evidence around the key theme of working with our communities to identify need and how we actually move forward with this as well. So really important that we've considered the evidence that's currently available, both direct and indirect, of the population impact. The position around our performance and also what we're expecting in terms of the technical advisory cell around the assumptions going into next year have been considered. So we have assessed our performance and service positions, and we will be submitting a technical minimum data set as part of our submission that sets out our expectations around performance going into next year. And we're in the process of, we've commissioned a piece of work on demand capacity modelling, which we're completing during Q1, but we continue to look at that and sort of make sure that we've got robust plans in place to try our very best to recover the position, and there's a later report on performance on that, which I'll cover later. And we've had two really important frameworks being published by Welsh Government over the last couple of weeks. That is the Recovery Planning Framework and also the National Clinical Framework, and we've been considering both those elements in terms of the content of the plan. So the main presentation today I'll be covering is around the priorities that we've sort of developed as a result of a consideration of those first 3 steps, and we'll be seeking the board's approval of those strategic priorities. Just a reminder then, on the next slide, we did a lot of work with our population around our long-term health and care strategy, and we spent a lot of time developing a set of key principles that helps us inform what we should be working on, and I just wanted to remind the board that these principles have been front and centre in how we've developed the content of the plan this year. I won't go through it in detail, people will be familiar with it, but in particular I'd highlight the evidence around inequalities means that we've got to really particularly think about fair access, a more equal Powys, and also addressing those with the greatest need. So that's an important part of the plan. The next slide covers really our overarching framework within the plan, and I apologise, this may look a bit complicated, but we were trying to summarise the whole approach around the one page. So I've just covered the principles, which are on the left hand side of this diagram. And before I get into the detail of what we'll cover in the plan, I just wanted to say that staff wellbeing, the last year, the staff have been absolutely critical to the response during the pandemic, and we've had to, and you'll see through the Workforce Futures priorities that we've identified, that staff wellbeing and recovery is a really core consideration as we go through into next year. People have worked tirelessly, and we know we have enhanced a number of things to try and offer more support to our staff during what has been a really difficult year. So it's in 3 key sections of the plan. We've got our COVID response, which picks up COVID prevention and response planning. So that will pick up elements of testing, our contact tracing work and our protection work, how we manage outbreaks, how we work regionally in those arrangements, and also the continued focus on communication. And the second part is the mass vaccination programme, which has been really critical, and I'll cover a little bit later the detail in the performance report on progress around the mass vaccination programme. The second part of the report is around essential healthcare, and we continue with focus on well-being and early help and support, which are key principles within our long-term health and care strategy, to have a really strong focus on well-being and prevention. And obviously continuing to provide excellent services around primary and community care, the work around essential care, our recovery work around planned care, our urgent and emergency care work is still critical, and how we support flow from all of our neighbouring district general hospitals and avoid emergency admissions. And then the important work as a commissioner generally across the whole system of care around making sure that our system plans generally align with our neighbouring Welsh and English providers. And on that point, I would say that there is further work to be done during Q1 to assess our neighbouring health boards' plans, both in England and Wales, to make sure that we are covering and understanding fully the impact of our neighbouring providers on the Powys population. And then finally, the renewal priorities, last but certainly not least, where we're saying we need to focus our main attention this year, recognising that taking into account the evidence and the issues and the needs that we're having to deal with, we've outlined 6 key areas of renewal, and that's around frailty and community, the work around long-term conditions and well-being, diagnostics, ambulatory and planned care, advice, support and prehabilitation, children and young people, absolutely, and tackling the big 4, again, important. Those 4 at the bottom of the page cover the 4 key enablers which are within our strategy. So I've mentioned before the workforce, the new digital ways of working and how they're embedded and scaled up to support our response moving forward, our innovative environments, our investment in capital, but also research and development, innovation and learning has got to be core in terms of what we're doing. And then the final element, which is around how we're transforming in partnership across all the regional, local and national partnerships that we're working within. The next few slides I'm not going to cover in a huge amount of detail because I think it's about having time for the discussion. Is you can see we've just lifted the content around the first immediate priority around the COVID response, and that's around ongoing delivery of our prevention response programme and the delivery of the mass vaccination plan. Now that looks like one page, but it's significant work and effort across public health, the organisation, to deliver all of those elements, and it'll continue to be a priority as we go into the beginning of this year and throughout. The second slide then is around the immediate priorities around essential healthcare, and the key areas of delivery are highlighted here at a very summarised level. You'll have more detail in your packs, but you know the scale of the challenge that we're facing is central to the renewal approach here, and in particular, you know, we're going to have to take a very whole system approach to this around both our whole pathways of care for our patients, and you can see I've already covered it off really in the plan on the page around some of the key areas that we're covering within the plan. I guess I would highlight a couple of areas just to reference. I've mentioned to you before about planned care, but again, that assessment around the recovery framework and how our local plans fit in with the regional plans, and then our assessment of our neighbouring health boards plans will be important, particularly around some key specialties which we know are particularly challenged, and some of the solutions that are considered, for example, around diagnostic, endoscopy, etc. So we'll pick that up. So in terms of the renewal priorities, these look simple, but they're an awful lot of work. So the first one is around the frailty and community model. And it is clear from our perspective that during the last year, there are lots of opportunities. So this is a positive aspect where we can look at how we can continue to revise and improve our approach to frailty and our community model to provide the best outcomes for our patients. So we'll be looking at areas like intensive community and home-based care, the particular work around how we can access and develop further our discharge to recover and assess model. The ethos of Home First is absolutely critical here, and obviously working through the virtual wards that we have very well established in Powys will continue to be a priority. We're already making very good progress, and joined up and 7-day working, multidisciplinary working is absolutely core. So again, really exciting opportunity here to look at how we can develop and revise this model with the value-based lens for this year. And I know there's a lot of support from clinical directors for that particular priority in primary care as well. The second priority is around long-term conditions and well-being. I think you'll find in the detail of the information, the extent of the impact on long-term conditions for our population is significant. So we're doing more of the same. We do need to renew our approach around this, and particularly well-being. You know, long COVID is another key priority around how we work with people as a result of their experience through this pandemic to help them to recover. So again, this is about being patient-centred. The principle of what matters to people is really important, and we need to think about how we can develop further the digital offer, but also more generally access to early help and support, recognising that we will have significant increasing need to deal with during this year around long-term conditions. And that prevention piece I mentioned earlier will be really important for us around how we provide that active offer and support around prevention. The third priority is around the significant backlog around planned care that we're facing as both a commissioner and a provider, and the opportunities of meeting our strategy around care closer to home within Powys. We already had a very active programme prior to the pandemic around repatriation of services, maximising the utilisation of our outpatient offer, diagnostics, ambulatory care, and also our day case theatres. So again, there will be significant opportunities here for us around how we can work with our partners to try and mitigate and try and help reduce the demand on secondary care services and do what we can safely and effectively within Powys. So this one is really exciting from my perspective and really aligns to the potential when we've been talking about North Powys Wellbeing Programme and the art of the possible around what can be coming back within Powys. So it's really good priority and potential, lots more that we can do there. The fourth priority, the advice, support and rehabilitation. So we know, unfortunately, that people will be waiting much longer for treatment, and it will take us years, I think, well, you know, to recover from the level of backlog across our system. So in particular here, this is about making sure that we have an active offer for those patients who are either newly referred into the system or are already waiting. So we're looking at how we can strengthen and make a more efficient referral support service. We're looking at advice and support pathways, so things like pain management, healthy weight, healthy lifestyles, looking at alternative offers whilst people are waiting for treatment, and prehabilitation pathways is key to that, and also how we can provide the offer again digitally. So again, really important piece of work, and we've made really good progress this year, particularly the work that Claire Madsen has been leading on long COVID. We've got a very well established pain management service, and we've done a lot of work already on self-care models within Powys. So again, it's about further enhancing and scaling up some of what we've already got and making sure that we can meet the level of need that we've got in the system. Renewal Priority 5, children and young people. We know the evidence is telling us about the impact on children and young people, and there's quite a lot of information within your packs around this. So in particular, this is one that we're working in partnership with the regional partnership under the Children and Young People's Partnership and Start Well, and we'll be doing a lot of work as a health board as well on key areas, which we'll pick up later in the performance report. We know we've got more work to do to improve, although we've made some progress on neurodevelopmental support. We know immunisations is really important. Children's access to dental care within the time scale is another area, and then therapy service redesign as well. So really important, and you'll see within the plan the regional partnerships board's priorities around children and young people that we'll be working with them on. There's also an element here around specialised services as well. So in the integrated commissioning plan for specialised services and for mental health services, that again with that children and young people lens will be important for us. And the final, I'm not going to cover this in detail, is the big four. We know that cancer, mental health, respiratory and circulatory diseases for us had been identified within our long-term strategy. The burden of these disease priorities need to be looked at again with the scale of the challenge that we've got to deal with, and we've got detailed programmes in place for all of those elements going forward. And this is at a high level referencing the need to again scale up, prioritise and make sure that all those four are taken forward for the next year. And then finally, in terms of the workforce futures, innovative environments, digital first and transforming in partnership, we know that as an organisation we've got to work very hard to make sure we get the right balance between meeting the needs of the ongoing COVID problems and also the core operational delivery of key services. But I think the key issue for us, and we'll be discussing with Welsh Government through the draft plan being submitted, is how we identify together the right capacity and investment to progress with the renewal priorities. And I hope that sort of a very quick run through of the plan. I hope that's helpful, and I'm really happy to cover any questions people may have with colleagues. Is that okay? Thank you, Chair. Chair, you're on mute.
You're on mute.
Right, sorry about that. I didn't realise I was on mute. Yeah, thank you very much, Hayley. That represents a huge amount of work. It's just the surface, if you like, and beneath that, you know, we're all well aware that colleagues have put in a huge amount of their time and effort, and very reassuring to know that they are basing their plans on evidence gained exactly, really, as you explained, during COVID, but on their own experience. So it's not only aspirational, it's very firmly based in fact, evidence. So I can see that Trish has made a comment. Would you like to, Trish? But I think Carol wants to come back, possibly at the end, Carol. So Trish, you wanted to make a comment about the King's Fund
yeah,
paper, I think, yes.
I think it is important that we understand, if we're to leave no one behind, we really do need to understand what the needs of the community are, strengthening the community connections and building resilience. And if we're to do that in a meaningful way, we have to have meaningful engagement with the people that have been disadvantaged, that are experiencing poorer health outcomes. And it's vital, I think, if we're to go down that road and succeed, that we need to look at how we engage, the questions we ask, and really work with the communities to help to progress this and make it successful.
Yes, thank you. Does anybody else want to comment or ask a question? Ian?
Yes, thanks, Chair. And thanks to Hayley and the rest of the team. Really comprehensive plan, trying to get all of that down to 30 pages, and I think the layout is really helpful as well. I've just one observation really from reading the detail in the new ways of working. I'm not sure if that's part of this presentation or we're taking the whole of 2.1 together, but in reading the new ways of working, which I thought was again an excellent piece of work, and the strategic priorities, I was just the two key messages for me that came out in that review were around innovation and improvement, and of course digital. That came out for me as very strong and powerful messages, and I just wondered whether our annual plan could be further strengthened up front by reflecting those two key priorities, that we show as a board that we're giving our commitment in terms of the innovation and improvement to the removal of the red tape and bureaucracy, as it said within that, and giving the priority that excellent piece of work on that review did as far as the digital stuff as well.
Okay. Hayley?
Well, I was going to jump in there, if that's okay, Chair. I'm happy to come in on that, because that they were going to be my sort of summing up comments at the end, really, in that, Ian, I think your question and your suggestions are absolutely right. We are a different organisation now to that of a year ago. Things have changed remarkably in the way in which we work, the way in which we've unfrozen some of our very traditional ways of working, the way in which we've had to accelerate the use of digital technology in all sorts of aspects of our work. And therefore you may have spotted towards the end of the annual plan a commitment to renew the organisational development framework. That is really about the how we work. There's the what we do, and then there's the how we do it. And I think, Ian, that absolute focus on the new ways of working that have come through, I would commend anyone who hasn't had a chance to have a look at that report to really look at it. There's a wealth of really helpful information in there from our own staff about what they've liked in terms of different ways of working, what's been more challenging, and then us trying to find the right way forward. What really stood out for me is the appetite for innovative ways of working and doing things differently. People have tasted something else, new ways of doing things, and by and large they've been positive, not universally, and we need to look at that, but they've been really, really helpful. So innovation is something that we've got to build on. The different ways of working, use of technology, etc. That's happened in such an accelerated time frame, and the sense of not wanting to sort of slide back certainly came through for me. So in the OD framework, which we're committing to reviewing as a key priority now in Q1, we will need to make sure we can capture those things. And as you say, Ian, streamlining, reducing bureaucracy, right-sizing the way in which we work is critical. So just wanted to come back to you on that to underline the importance of your comments. If I may just add one more thing, Chair, and that's that some of this plan is at this stage marking the key statements of intent in terms of renewal priorities, and the need now during Q1 to establish much more detailed proposals in order to put those to government. The new government will be in place, of course, in order to secure investment to make those things happen. So I just wanted to outline that in case we hadn't made that clear, that we would be expecting some additional investment in order to take forward those proposals, but we will be working them up over the next month or two now in order to be in a really good position to move forward. Thanks, Chair.
Thank you, Carol. I think Ronnie wanted to come in. Did you have a comment, Ronnie?
Thanks, Chair. If I may, Frances Gerrard, independent member, is unable to engage in the meeting. So if I could just add a comment on her behalf, if that's okay. So thanks, Hayley, for the presentation. Agree with the points. The real issue is working out how to prioritise in a way that generates cooperation. If I could just leave that there. Thank you.
Thank you. Yes. And thank Frances, please. I hope she can hear what we're saying. I'm sure she can, but it's a shame that the technology isn't quite right yet, even now. But we're well on the way to improving things. Thank you very much. Is there anything else anybody wanted to say about this before we go on to approve the strategic priorities for 21-22 for renewal and recovery?
Chair, may I come back in if that's okay? I know Carol may want to as well, but I think that Frances's point is a really important one. It's very difficult to present a summary of the plan, and there's an awful lot of detail, and I would say that in the discussions, particularly the engagement with local partnership forum, staff side partners, but also CHC and others, there are a number of priorities that people talk to us about and see as important. I'll give you as an example, carers and the impact that this has had generally on both paid and informal carers across the system. Those sorts of issues are within our plan. I haven't probably brought out all of the aspects that people would be seeking to look for in terms of the discussion, but I hope you can see that from the detail that's contained within the broader presentation that we've shared. And again, just reinforcing the workforce element is that the point that Carol raised around innovation and improvement and people's willingness to change and work in very different ways has been remarkable. But we also have, we're going from a very intensive period of time of working through to very important work to do on recovery and renewal. So you'll see from the content that well-being aspect is something that I think we'll have to just track very carefully as we move through the various stages of recovery of the pandemic. And I wanted to reinforce that from the point of view of some of the points later when we talk about that performance and generally some of the issues that we're dealing with. You know, it's remarkable what the teams, staff in partnership with volunteers and communities have delivered during this period, but we will need to sort of watch that well-being aspect quite carefully as we move into the delivery aspect of the annual plan. Thank you.
Well, I mean, I can only just reiterate my thanks. You know, it's really quite breathtaking, the large amount of work in such a short time to produce the draft. So thank you to all colleagues involved in that, and especially to Hayley and Sam, but everybody else who supplied information and made their own comments from all of our staff, really. So thank you very, very much. So could we please approve the strategic priorities for 2021 to 22 for renewal and recovery? Yes, I'm not hearing any dissenting voices, so I'm assuming that the board does approve the draft, and we look forward to seeing further developments. Thank you very much. Right, we need to move then to the capital programme, which there is a document which you have been sent on that. Wayne Tannehill is in attendance if Hayley needs any extra support from him, if her voice wears out even. And I'd hand over to you again, Hayley, on that.
Diolch Cadeirydd am y cyfle I gyflwyno'r rhaglen gyfalaf. Thank you, Chair, for the opportunity to present the Capita programme. Wayne is on leave, Chair, so it isn't on the meeting, so yes, are difficult questions. I might have to refer outside the meeting, but thank you. So this draft Capita programme comes to the board on an annual basis. You'll recall over the last couple of years we've developed a 2-year programme because that gives us a longer leading time so that we are able to take a broader prioritisation approach around our discretionary Capita programme. But the report covers a number of aspects really, and we considered the detail of the report in the Performance and Resources Committee on the 22nd of February, and we are recommending this report for approval. But I'd just like to draw to your attention a couple of pieces of information that we didn't fully consider at the Performance and Resources Committee on the 22nd of February. So we were aware that we were successful in securing a total of just over 1 million from Welsh Government capital slippage in January, which we did discuss at committee, and that's been really, really beneficial. We've been able to secure essential equipment, medical devices, and also deal with a number of critical infrastructure works, boilers breaking down, etc. as a result of that additional slippage. So very grateful to the Welsh Government for that. And since the meeting as well, of the committee, the team had submitted to the Estates Funding Advisory Board a new sort of bidding process really that was available to support infrastructure, fire investment and decarbonisation, which is managed with Welsh Government and shared services. And we're really pleased that thanks to Wayne and the broader team who've worked tirelessly to attract this additional investment, we had secured successfully through that bidding process 2.21 million from the board to support essential fire compartmentation schemes, infrastructure investment to continue on boilers and roofs, and 3 decarbonisation bids. And I just wanted to say that that represented 6.27% of the overall available allocation for Wales. So the team, the quality of the bids that were submitted and the ability to have attracted that together with the Welsh Government capital slippage has given us access to an additional 3.2 million investment in total through that work. So that was really good news. So the discretionary Capita programme is over 2 years. We are recommending it for approval. It's been based on risk prioritisation, so we look at a number of issues and we list them in priority order based on a number of factors. We look at risk, health and safety, what we need for service development and service delivery, and we've had a really strong audit as well on the process that we've got in place with that, and had the approvals through both the Innovative Environments Group and executive support for the proposed programme. And then finally, just to say, during this period, the report covers the fact that we also achieved a substantial assurance rating from the recent capital systems audit, which is good news because we are awaiting, we've got a really strong capital pipeline that we've submitted to Welsh Government for approval, and I think that leaves us in a very strong position to give assurance to Welsh Government about our ability to deliver year on year the capital priorities and programme. So, and just a final thanks from my perspective, the team have worked really hard on helping us to respond as an organisation, the Estates and Capita team, to COVID and the pandemic. But I think that we're in a strong position going into next year with a proposed 2-year discretionary capital programme, a good pipeline for always capital funding that we're awaiting a decision on, and the third element is around that ability to reduce the backlog maintenance and risk through the additional £2 million investment, because I know on a corporate risk register perspective we've had that risk very high, and you know we will be making excellent progress on addressing some of those issues during the year. So that's a quick summary. Happy to take any questions.
Thank you. I know Mark has a question first, and then Tony Thomas, so, and then Ian. So Mark, over to you.
Thank you, Chair. I just wanted to support Hayley's comments, and I've already spoken to Wayne and passed on my congratulations to him and the team in terms of the progress that they've made. I'm particularly happy with the anti-ligature funding, because that allows us to address something in a whole rather than try to take it in bite-sized pieces over a number of years. So I think it just allows us to make an impact much sooner and sort of more efficiently. And I think it gives us a really good opportunity for actually increasing our capital programme in the sort of medium term to fill in around some of the more major schemes that have been approved or in the process of being approved. I think it stands us in good stead going forward, and hopefully resources will flow into the estates team in a form that allows them to effectively deliver on this challenging target as well. So many thanks.
Thank you. And Tony.
Thank you, Chair. I'd first like to comment how much we've improved our position on capital over the last few years in the control. I mean, we did have some difficulties a few years ago. I think Carol probably remembers it very well. But we've moved on since then, and it's great to see such improvement in capital. Could I just clarify on page 5 the list of project titles? Have they all been subject to the socio-economic obligations that we now have?
Thank you, Tony, for that question. I think all of these schemes have been submitted specifically prior to the socio-economic sort of question. However, what I would say is we can do that check, because these are when the decisions come back, we will look at them all, because I think the principles generally will be covered, but I think we probably need to do another final checklist against it. But I certainly think from the point of view of community benefits and the expectations around how we utilise capital funding, a number of the principles in the socio-economic duty, Tony, is already covered. But I think I'd take that back and just do another quick check, if that's okay, just in case if there's any additional requirements that we may want to consider, if that's okay, Tony.
Yeah, it just seemed an ideal opportunity, having spending such substantial monies, and we've just agreed the other report. But if it's possible to run it through that, then albeit the better.
I'm happy, Chair. Perhaps I could, for the P&R committee, pick that up as a follow-on, just to double check. But I'm pretty confident that, you know, we will have most of that covered. But I think that formal checklist approach would be really helpful, Tony. I can bring it back to P&R.
Thank you, Carol. I think you wanted to come in on this. Did you?
Yeah, thank you very much. I think it's a really good question, Tony. So there are some in this programme that are responding to some really quite challenging estates risks issues, and we know that the risk issues around estates have been very long, and we are chipping away at that certainly over the last few years. But the one or two areas that would stand out in terms of socio-economic duty is the development in North Powys, and in particular in Newtown. We know that we identified that as one of our core strategic priorities under the health and care strategy for the first couple of years because of the socio-economic deprivation and the challenges that some communities face. We also know that Llandrindod and the investment in improved health services in the Llandrindod area will help to address some of the socio-economic issues there. But the final area is estrogen lice, and whilst estrogen lice has been an area that we have wanted to take forward in terms of development proposals, we've been hit by the pandemic in relation to that, but you'll see within the report there is a substantial investment in estrogen lice hospital to ensure that the facilities are upgraded, particularly around the heating systems, etc. So not an insignificant amount of money, but to say that in future capital programmes, estrogen lice will continue to feature. And it might just be worth me saying, I was going to make this comment at the end, Chair, but I can make it now, is that we approved an interim strategic innovative environments framework last year, and the pandemic came. We will be getting back to that longer term plan. That is a commitment, but also to recognise that the renewal priorities under the plan we've just approved may well have capital implications. So we will, if those proposals do indicate that we would need capital investment, be preparing cases for, again, Welsh Government's assessment under the capital allocation. And I would like to think that on the track record that we've now built in terms of capability, that they would be seen favourably. So just a couple of comments plus picking up Tony's query. Thank you, Chair.
Thank you. I'd like to bring Ian in now, please.
Thanks, Chair. Just a question from me on the general projects on page 10. Really great to see some not necessarily innovative stuff, but us getting to do some really important stuff here. And I just wanted to make sure that I'd made the correct assumption in this, because there's a note against roof repairs, and the assumption that I've made based on what you said is that that's a different source of funding. It's not that we're not going to do it, and I didn't want anybody else to make the mistake that those things weren't in there, if of course my assumption is correct.
Yeah, I'm happy to answer that, Ian. I think that firstly, the additional Estates Funding Advisory Board funding, the 2.2 I mentioned, is additional funding that we've secured. But the expectation and the clear guidance was that's not to replace existing commitments that we've already made in terms of dealing with backlog and infrastructure issues across the estate. So yes, those particular issues around roof and boilers, the two roof repairs, which is zero, will be picked up with the EFAB funding. But what we've done is we've redirected, because that was easier to make it a more compelling bid to do roofs together for the EFAB funding. But I want to just reassure you that that funding is still allocated from the point of view of infrastructure on the broader. But yes, those works will take place.
Fantastic.
Yeah, thank you. I don't know, Carol, whether you wanted to come back again on this or whether you said what you wanted to say earlier?
No, thanks, Chair. No, I largely said what I wanted to say, but if we do take a reflection back over the last 4 or 5 years, as Tony had indicated, we've come a very long way in terms of capital and estates. Yeah. And I would just say that this year has been both challenging, but also an extraordinary year in terms of getting quite a lot of work done and getting a lot of support into the organisation. So the total capital allocation and expenditure has been remarkable in terms of what we normally have under sort of £2 million sort of discretionary. I think we've had up to about 6 million. Peter will nod, yeah, it's in his report later on, make sure, about 6 million. And for us to be able to manoeuvre that, manage that, and get the work done effectively to a substantial assurance standard as well, I think is remarkable. So we've come a long way. I think we should be very proud of that achievement, and it spurs us on for the next stage of investment, I think.
Yeah, thank you. And again, thanks to Wayne Tannehill and his team, because they've worked hard on this. And he's sitting around the table here, rather like the virtual table, I should say, rather like Banquo's ghost. But we know that his presence has been invested in all of this, so thank you. So can I ask you to approve this revised draft discretionary capital programme for 2021 to 2 and 2022 to 3? Yes, good, thank you very much. And now, excitement, we turn to the introduction of the socio-economic duty for Wales and our own policy there. So thank you.
Thanks, Chair. I'll take this paper on behalf of Claire Madsen, our Executive Director of Therapies. She's unable to be here with us today. As we've mentioned a number of times this morning, the socio-economic duty comes into effect from today, which will mean that going forward, the board will need to be able to evidence that due regard has been given to the impact of its strategic decisions upon those living with socio-economic disadvantage. So to support that, the existing equality impact assessment policy has been reviewed to include the requirements of the duty, along with an updated assessment tool, and it's presented here today for the board's approval. If I can just note that we've received some comments since papers have been published from the CHC, thanks to Katie for those. In the main, these include updating the statutory requirements section to include the CHC regulations and NHS Wales guidance on consultation and engagement, and including specific reference to seeking views of the CHC and other key groups when undertaking a quality impact assessment. So we will take those away and reflect on those in updating the document. But I'm happy to take any questions.
Are there any questions? And we have had training about this, and you know, we've also it's very good to see that independent members also have taken all that training on board. That's very clear from some of the questions that have been asked. So thank you, Ronnie. Are you happy to approve the implementation plans subject to you know, the comments that we've received? Tony, did you want to say something?
You're on mute, Tony.
Chair, I think Trish wants to come in, so if we take Trish first.
Yes,
yeah,
let's take Trish.
Thank you. I think this is a really important duty that we're taking forward, and I think we need to take it seriously. And I really wondered what we at the board can expect to see in terms of ensuring that we are complying with our socio-economic duty. What difference will we expect to see in papers coming to the board?
If I can I hand to Carol on that, because I know that Carol wants to comment anyway. Is that okay?
Right. Okay.
Yeah, thank you. Thanks, Trish. I think that's a really helpful question, and if there are members of the public watching, they may well be asking the very same question. I would refer us first and foremost to our health and care strategy. The principles that Hayley presented earlier, and the 6 core principles that we developed with the people of Powys, remembering 10,000 contributions to that strategy, we did agree on the one that I think stands out the most on socio-economic duty, which is focusing on the greatest need. So what it actually means to us is, are we really thinking about those communities who have a socio-economic greatest need? Where are we giving the areas the due regard? Are we considering the impact of anything that we may well be developing on those communities? And are we helping to address really the underlying inequalities that exist in our county and in our society? So I think when we are making decisions about developments, for example, in the same way, I think as Tony just asked really about the capital, is have we considered the socio-economic aspects in terms of developing this programme? So if and when we bring proposals back, and I'm sure we will in the next quarter in relation to the renewal priorities, that key question keep coming back to, so how, have we thought about, because that's what the duty is, it's a have we thought about, have we actively considered the needs of those populations? And I think the board and the public should expect us to demonstrate that. We as a board need to demonstrate that we have indeed given that consideration, and that we explain that in our papers. So I hope that helps, Trish, in terms of the difference. I'd like to think that we were already rooted in that, given the work we did on the strategy, but I think we will need to be even clearer than we have been before, that we have given that very due and active consideration.
Yeah, it's a question of being explicit, I think. Thank you. Tony.
Can you hear me now?
Yes.
Oh, good. The list here of starts off age groups and so on and so forth. Unless I missed it, I was aware from watching something on the television recently that during the pandemic there's been an increase in domestic abuse throughout the UK. Should that be mentioned, the fact that we may want to get more involved in domestic abuse, whether it's providing safe homes or safe places or whatever, should that be amongst this list? That's all the query is, or does it belong somewhere else? I know the local authority are obviously involved, the police are involved, and I assume the health board are involved. It's just a question.
Happy to come back in on that. Thanks, Tony. I think the list that you refer to is the list of protected characteristics. Yeah. What I would draw attention to is a different piece of legislation. So again, enshrined in law around the Violence Against Women and Domestic Abuse Act, and Alison Davis, our Director of Nursing and Midwifery, leads on that under that now very broad safeguarding agenda. And as Mel said earlier, as a independent member, the Vice Chair's input into that broader safeguarding. I think you're absolutely right in that the pandemic has accentuated and probably escalated issues in households, and the awareness of domestic abuse and the recognition of that has increased significantly. And I have no doubt that there will be sort of consequences of that now as we move through the pandemic as well, in terms of mental health and other related matters. I don't know if Al would want to comment about that broader focus on domestic abuse, because Tony, you're absolutely right, it has been really critical part of the work and the experience during the pandemic. Is that all right, Al?
Yes, thanks very much indeed, Carol, on for your question, Tony. It's such an essential part of our agenda going forward. And just reflecting here that at last Experience Quality and Safety Committee, we had quite a detailed update in relation to our safeguarding and public protection focus over the last year. And I wonder whether I'd be very happy to bring a further update to the committee, Mel as Vice Chair there, particularly looking at our work around domestic violence. We do work really closely in partnership, Tony, you're quite right, and we work hard to prepare our staff to be in that exact right position for our community to be able to help spot and intervene early where that's appropriate. Mel, I'm not sure if you'd support that as the way forward.
Absolutely. I mean, you know, all three really, the domestic abuse agenda, the mental health agenda and the children and young people's and the impact of the pandemic around all of those issues, we're going to need to understand thoroughly going forward and what the impacts of those have had during the, and how we can enable those to move forward now in the circumstances. So a further report would be more than welcome in those that whole agenda.
Okay.
Thank you. I'm not sure, Susan, do you have a question?
Thank you, Chair. Well, it's part statement, part question. Certainly, the socio-economic duty is so important in working with social services, discharge planning, service provision in different localities. I'm very conscious that this is such a busy time for the clinical staff still, and I wondered, in fact, if the training had commenced or what the plans are, how long further along the road may it commence?
So I'm happy to pick that one up, Chair. Thank you. Thanks, Susan. So I think there are responsibilities at each level in the organisation, and you're absolutely right. If you like, people in sort of clinical practice have been extremely busy trying to deal with the day job in very challenging circumstances. So there has to be a careful sort of step forward in terms of training and development for new things that are coming on. I think getting this right at the strategic level will help enormously, and hence the paper today and some of the training sessions that have been put on, and I know some board members have attended training on this. The intent moving forward is for our senior managers and our senior clinicians to be aware of this duty. And again, I'd like to think that some of this is inherent in the work that we do, but the emphasis now on illuminating that and making that much more explicit and transparent is key. And then raising awareness really amongst those frontline clinical staff, so that people do really understand the duties placed on us and the role that they can play as well, Susan. So I think we're taking a careful approach not to overload people. We've got some other pieces of legislation coming in as well, so there's still a lot going on that is could be considered connected to COVID, but not directly, and so we're just trying to manage that. I know that there has been a bit of concern about sort of the overloading staff, so if that was where your point was coming from, we're mindful of that. Thank you, Susan.
Thank you.
Thank you very much for that question, Susan. Very relevant. So are we now in a position then to approve the implementation plans for this? All right, thank you very much. Everyone happy? Good, thank you very much. Now it's over to Alison to talk about the methodology applicable to funded nursing care for 2021-22.
Diolch, Chair, Bore da everyone. Thank you for the opportunity to present this paper. The paper provides a summary of the position regarding funded nursing care. It provides a recommended option for setting the funded nursing care rate for the next financial year. And it also seeks board approval for the methodology to be used to set the funded nursing care rate for the next financial year also. So just to refresh board, funded nursing care refers to NHS funding of registered nursing within care homes, where the need for nursing input to a person residing in a care home has been assessed as necessary. This is a statutory requirement, and just to remind board members, funded nursing care rate covers both the cost of services provided by a registered nurse along with funding for continence products where these are required. Board, I know, has been previously made aware of Supreme Court judgment in 2017, where the Supreme Court provided its own view of what should be included in funded nursing care, and the rate was subsequently adjusted following that ruling. The rate is broken down in Appendix 1 of the paper, the current way in which the rate is set, if that's helpful. So since 2014, the inflationary uplift mechanism is the methodology that's been used to set the rate. It comprises of the labour component, the time spent in providing direct and indirect care, as well as supervision by the registered nurse, and has traditionally been at a midpoint for Band 5, and the continence supplies component, which it changes annually in line with the Consumer Price Index. So the inflationary uplift mechanism was initially improved for a period of 5 years by health boards, and in 2019 boards approved a proposal to extend that for a further 2 years, and would fall into line with the revised funded nursing care policy guidance. The current extension ends at the end of this month, March 2021, and this has been considered by health board professional and finance leads in relation to what options there are going forward into the next financial year. Bearing in mind that the funded nursing care policy, national policy, is yet to proceed in terms of review. So options that are being considered, mindful of the Supreme Court definition, the factors that need to be included, and the need for a sort of contemporary policy framework to work within, a couple of options have been identified. The consideration being to retain the inflationary uplift mechanism for this financial year, with a commitment to review that as soon as the policy position is revised. This recommendation, this option has been recommended, has been considered within health boards by lead executives and by chief executive officers of health boards also. There is a commitment to review the policy set in the spring of this year. So we are hopeful that the recommended extension shouldn't apply any further than this coming financial year. The views of other key stakeholders have been sought, and there have been no specific objections to this as a way forward. So Chair, you'll note point 3 of the paper where the recommendations are made. If board could please note the need for the review of the methodology, note the impact of the COVID-19 pandemic, the lack of a contemporary policy setting as key factors in this, and note the recommendation please made to retain the inflationary uplift mechanism for this financial year.
Yes, thank you very much. It's been rather inevitable, this review, hasn't it? It's been clear it's been necessary. Are there any questions about it or reflections? Mel?
Chair, no, I was just going to say it's a very sensible and practical way forward over the next 12 months, isn't it? Albeit so we can arrange a review, look at it in its fuller context and bring it back to board. I mean, it needs to be done, but it's not the time and place at the moment to be looking at this. It does need a review. It does need to come back in a fuller sense.
Yes. Thank you. Thank you. Can I ask you to approve this? Thank you very much.
Thank you, Chair.
Thank you. So that then brings us to the third section of the agenda, the performance overview. Hayley, please.
Thank you, Chair. Diolch. Diolch am y cyfle I gyflwyno'r adroddiad perfformiad diweddaraf i'r bwrdd. Thank you. This report provides a high-level summary of the latest performance position. The latest available position, if I'll start first of all in terms of some of the COVID position, is that we've cumulatively, as of the 26th of March, 4,231 residents have had a positive test outcome in Powys. The latest 7-day case incidence rate for the week at the 10th of March in the report was 35 cases per 100,000 population, and I'm pleased to update the board that there's been a further reduction to that rate, and it is currently standing at 18.1 per 100,000 population. In the report, it references the test positivity rate at 4.7%, but again, with the latest information yesterday, that's now 2.2% based on 1,067 testing episodes. So it's really pleasing to see some really positive sort of movement there. Sadly, you know, the information in the report around the number of people who sadly lost their lives to COVID as of the 25th of March is sadly 266 people, and that is based on the latest figure from the ONS data source, which includes any COVID deaths with a mention of COVID as either primary cause or a related factor. We're making good progress in delivering our prevention and response programme, working alongside our county council. The contact tracing performance still remains good, and you know, testing, delivery and outbreak management still constantly being delivered. In terms of the mass vaccination programme, we're meeting the delivery milestone 1. We did that for priority groups 1 to 4, and we are in the throes of getting to the delivery milestone on the 19th of April to ensure that people over 50 are offered their first dose vaccine. And just to give you a bit of a sense of that scale, we've delivered over 23,000 first and second doses over the last fortnight, and we will be reaching the milestone of over a total of 100,000 vaccines by later this week. So really making good progress on the delivery of the mass vaccination programme. Just for the board to note, we do expect a drop in supplies during April, which has been covered both on an UK level and on a national basis, but again reassuring the board that this will not impact on the availability of second doses. So that's an important point. Yeah. Okay, on a summary level then, in terms of the broader aspects set within the report, we've already touched on this a couple of times, but the snapshot shows the significant backlog of people waiting treatment. We now have over 2,000 people waiting more than 52 weeks for treatment as a commissioner across Welsh and English providers. And as a provider, we have a total of, according to the February figures, 554 patients waiting longer than 52 weeks. And we've got key specialties of concern. Those are the same across all providers, particularly trauma and orthopaedics, ophthalmology and general surgery. Clearly also concerns in other areas, including cancer, where early detection is vital. And I think that latest performance information reinforces the fact that we've agreed the renewal priorities earlier in the annual plan around the importance of prioritising this work for this next year. To reassure the board, referrals and those people who are waiting are continuing to be risk managed to ensure that we're trying to provide the most rapid and equitable care possible during quite a challenging time. And we've also got good content in the report about the progress that's been made around diagnostics and therapies, but again reinforcing the need to ensure that the renewal priorities provide that active offer of advice, support and prehabilitation services to support those who are waiting for treatment. The performance report covers the progress with vaccinations generally, and I'll just highlight the ongoing work that the teams are undertaking around key targets around particularly flu vaccination and the MMR vaccine. And we've been in ongoing discussions with Public Health Wales around the key point in the report around the breast screening rates that's highlighted, and we're continuously focused on improving performance against those important areas. The report covers good progress against the mental health Part 1 and Part 2 measures, but also highlights the need to, and the work that's been undertaken by the operational teams around addressing neurodevelopmental weights for children and young people. But we have shown an improvement during quarter 2 and 3 to 60% compliance. So it's on an improvement trajectory, but more work to continue. With regard to dementia diagnosis rates for those over 64, this remains an area of focus, and I know board members have asked for progress on that on previous occasions. So again, continuing to work to improve that, and also the work on the compliance to complaints. And in quarter 3, we've seen an improvement with the Health Board recording 69.4% compliance against the 75% national target. So, you know, huge amount of work that's gone in around the complaints compliance recently as well. A couple of other points I'd highlight is that we picked it up earlier in the discussion around the renewal priorities, is that there is a new measure in the performance reporting around particularly the percentage of children regularly accessing NHS primary dental care within 24 months. So that is an area of focus for the dental team now going forward, recognising the importance impact on oral health and the need to look at that. And then the final one is around workforce measures. They remain important to us, and we do note that there has been a decline in some of the areas, but during this new quarter, we are continuing to work to try and recover the PADR rates to increase mandatory core skills performance, and it just noting again the ongoing work on sickness absence. Although we haven't met the 12-month reduction target on sickness, it should be noted that our rolling 12-month figure for sickness is reported at 4.97% in February, which is a slight improvement monthly. So those are sort of key areas I wanted to highlight, Chair, for board members' awareness. Yes. And I'm happy to field any questions.
Yeah, I was just whether we should perhaps pause here because there's a huge amount of information in this report, and I'm sure there'll be. So would you like a break briefly? I know this has come in too. So Carol, how do you feel about that?
Yeah, thanks. I just wondered if obviously Hayley's presented the overview, but as we go through section by section, directors will want to comment on the specific areas to note, I think, and to discuss as a board. So if I might suggest that we almost go back to the beginning. I know Stuart wants to come in on the COVID cases, and Hayley's identified some flags, and individual directors will want to come in on those, if that's okay, Viv. Thank you.
That's fine. It's a particularly important report, this. So
Stuart first.
Yes, Stuart, yes.
Yes, thank you. Thank you, Chair. I didn't want to lose sight of the COVID case numbers, really. I think it's important that we just reflect and acknowledge those. For the purposes of board, I had a quick look at today's report just prior to the meeting, and so the current 7-day case incidence for Powys is just about 14 per 100,000. That's really, really low, and that's really excellent. And that's about 19 cases in a week, and a positivity rate of less than 2%. So a really fantastic position for Powys right now. I did yesterday go back and look back at 27th of January when we last met as a board, just to put the figures in context. So if we roll the clock back to when we last met, we were at 30 cases a day. So we're at 19 a week at the moment. Back at the end of January, we were at 30 cases a day. And we had a 7-day case incidence of 157 cases per 100,000. So that's down to 14 now. And we had a positivity rate of 12%. It's now at 1.8%. So I think that helps to put into sharp relief just how far we've come in a relatively short time period. Obviously, the lockdown now has been in place for 3 months, just over 3 months, but that's delivered a big reduction in our case incidence and cases in Powys, and I just wanted to note that, really, just the progress that we've made. The other bit about vaccination is absolutely fantastic, and it's one of the ways we will get out of this. My only comment on vaccination is if you do read into vaccination coverage, it's pretty clear that even by the end of July, there still will not be enough people vaccinated in Wales to prevent significant outbreaks occurring. So we're in a very complicated position, really, where on the one hand, we have a really positive message about low case incidence, vaccination expanding, gradual release of non-pharmaceutical interventions, which is all really great news. The flip side is it's absolutely imperative that the population continue to adhere and follow the instructions around social distancing, mask use, etc., etc. And I just wanted to stress that point, really, that we've made really fantastic progress in Powys and in Wales as a whole. It's important that we continue, however, to follow both coming for vaccination if we're invited, but also the further interventions that we have in place as we move forward, because that will be what will get us through the next few months in a good place. So I just wanted to make that point and put the figures in context. Thank you, Chair.
Thank you. Yes, very important information there. Difficult to assimilate. So much happens in such a short time. Ronnie, I think you say that Matthew Dorrance has a question which you need to put on his behalf. Is that right?
Sorry, Matthew's unable to contribute during this session, but he is watching and sending in his questions. A question from him on this, if I may. So, what is the projected impact of vaccine supply issues on delivering first doses by the promised milestone of end of July?
I'm happy to pick that up if that helps. Yes. Thank you. So just to say that we're confident about the mid-April. In fact, you know, we're very, very close to that now already. And as Hayley has said, there's been a significant boost in the supply over the last couple of weeks. I think the end of April, we are reasonably confident. The reason we say reasonably is that we can't always control the supply issues, and the timetabling of supply isn't yet right to the end of July. So we tend to get the supply information for the next 3 to 4 weeks. So we have that, which is why we know that there is a reduction in the supply in the coming next few weeks. We believe supply will pick up again in May. But we haven't had the full detail of that yet. As I say, we have tend to have a rolling 4-week information on supply. So it's a little bit far to the end of July to be able to give a high level of confidence. What I would say, though, is that we've moved through the last sort of 80+ days now of the vaccine programme with uncertainty on supply. But we've still been able to achieve quite phenomenal numbers, as Hayley gave in her report. So unless there is a major supply issue, I think we can have reasonable confidence that we will achieve that end of July milestone. I would, just through this board meeting, encourage people to continue to take up the vaccine. We've had phenomenal uptake in the early stages, and we would continue to encourage that for the very fact that Stuart said, we need as many people as possible in order to reduce transmission and give us every chance that we won't get as much resurgence and outbreaks into the autumn and winter period. So, Matthew, we are hoping that the supply will continue to come through, although we recognise it's been a bit bumpy along the way.
Thank you. Mel, did you have a question?
Yes, thank you, Chair. Mine was really around, it touches on what Carol's just said. about the do not attends, and I've seen, obviously, as we all have in the press, that in certain areas across Wales they've had actually quite a high proportion, and I was really wondering whether or not our county is suffering from that at this present point in time, just from a percentage point of view, you know, whether we're seeing that, and if so, what we can do to message that out, you know, and to encourage people to come, as you've just said. So it's sort of similar to the comment you've just alluded to, Carol. Thank you.
Yeah, thanks, Mel. Hayley may want to comment. We did see an increase in the did not attend and the declines around a couple of weeks ago, when there was concern around the AstraZeneca and the potential for blood clots issues. It is probably a useful opportunity for me to reinforce that the study that's happened, and this is real world experience study in Wales, looking at the specific blood clot issue. Public Health Wales undertook this work and have indicated that there are no cases in Wales. The advice continues to be that the risks are, you know, in terms of any vaccine are low, and particularly this vaccine in relation to the risks of serious disease and sadly death from COVID. So the information is available. We are trying our best to make sure that that's accessible to people through our stakeholder bulletins and our website, and certainly when people attend our vaccination centres, there are trained, you know, clinicians, vaccinators on site, and pharmacists to provide specific advice to anyone who might have a concern. But we would strongly encourage people to come for their vaccination. We can see in no short part the positive impact that the vaccination programme has had on case rates, in addition to the social distancing and the lockdown measures. So it is having an impact, a positive one.
And right,
do you want to come back?
Yes, just to follow up really about the fact that we've actually got lists, haven't we, that people can put their names down on, and therefore if we do have extra vaccinations, they can be contacted at very short notice, and those people can come forward before they would have otherwise needed to.
Yeah, absolutely. And we've used these reserve lists all the way through. It is important, and it's great if we can use the public board meeting to remind people that on our website are reserve lists. You can indeed put your details in, and we are intending to have extremely low levels of vaccine wastage, and we've done really well so far. So those lists are really important for us. People can come and get their vaccination early. Hayley, was there anything else you wanted to add? And I know that we'll want to move on to the any other parts of the report then. No, thank you.
I don't know if Susan's questions and Tony's are related to this particular part of the report.
Thank you, Chair. I did actually put up on the chat bar. Thank you, Carol. You've answered my question. That's what I was going to. I can also reassure the board that the reserve list is used at the end of every session, and there's very good attendance from that reserve list. So it's a very useful tool.
Lovely. That's good to hear. Thank you, Susan.
Right, so it was Tony then next. Was yours about vaccines?
Yes, it is about vaccine. Just clarity on, I saw Mark Drayford on television talking about nobody could go on overseas travel. In fact, virtually everybody in Wales goes to England to travel anyway when they go abroad. But what's unclear, I just wonder what pressure is going to be put on the health board, that there may be, when they decide people can either go or not go abroad, there may be huge pressure, because you may have to have some sort of passport vaccine, or the little card we have, perhaps with proof of 2 jabs. I mean, are we geared up for the possibility of Boris Johnson saying in the near future we're going to have holidays abroad, and there may be a mad rush to get whatever paperwork is necessary from the health board or the doctor's surgery in order to satisfy the appropriate airlines? I've been asked this. I've been interested in it myself, but I've been asked it by a number of people outside as well.
Yeah, lovely. Thanks, Tony. I must try not to comment on how beautiful it is in Wales to holiday and looking after the local economy, because I know some people would wish to travel further. There is discussion, as you indicate, about vaccine certification or vaccine passports and the terminology around that. At this stage, the government has not outlined to us the likelihood of that coming through. I can imagine that there would be some pressure from the holiday industry, particularly airlines, to see this sort of thing come through, to give confidence about travel. But as yet, we haven't had any information on if or when that this would come through, and so we will just need to wait and see, really, Tony. And I would like to think that consideration about additional administrative measures on the NHS would be a key consideration going forward. It might just give me a chance to say as well that there is some work underway, obviously, on the revaccination or the booster element of the programme. So again, we're looking to continue to build people's immunity to this. So I'll sort of leave that there, Tony, if that's okay. So we haven't had information yet.
Thank you.
I can see there are more people wanting to ask questions. Can we deal with anything relating to the vaccinations before we move on? The question from Francis, was that related to vaccination?
It
Ronnie?
is, yes. Thanks, yeah. Chair. It's for Stuart. Sorry, just bear with me. Oh no, my computer. Sorry. Can we ask about anxiety for autumn with lightening of lockdown and variants? There seems to be some anxiety by virologists.
Sorry, Rani, just repeat the first part of the question. I didn't quite hear it.
You're testing my technical skills. Anxiety for autumn with lightening of lockdown and variants.
Yeah, absolutely. It's a really good observation to make. That I tend to be, I think, on the more pessimistic side about where we're going with COVID, but it's probably the nature of my role to be that way. If you look at some of the modelling that's being produced, either on a UK level through SAGE or more locally through Wales through the TAC, there seems to be a couple of predictions or projections that are going through the models at the moment, one of which is a potential uptick in the sort of May-June time of this year, I think largely linked to restrictions coming off, but then particularly going into the autumn-winter, there is some suggestion in the system around the projections that we might see some degree of an uptick in cases. I won't call it a third wave, but an increase in the autumn winter, linked to what we really know about flu virus and other coronaviruses. They tend to be more prevalent in the autumn winter period for various reasons around social mixing. So yeah, absolutely, I share that anxiety about where we'll be in autumn winter. I think on a wider point, it's pretty clear to me that test, trace, protect, wider measures in society, mask wearing, hand washing, distancing, for the next year, probably 2 years, if we're being honest, at least, we're going to be in a position where it might be on a cyclical seasonal basis, but there will, I think, undoubtedly be periods where we will have to look at introducing measures and keeping measures in place that we've currently got to try and keep a control on incidents as we go forward. And I think particularly this autumn winter, and you see it in the context of our annual plan, you know, that first immediate priority about managing the impact of COVID this year, a big part of that has got to be about our winter planning and how we're going to both protect our own workforce, but also ensure that if we do get an increase in cases, we're able to manage those and support case finding, notwithstanding the vaccination programme. So I would share that anxiety, and I think it's pretty clear that Test, Trace, Protect programme will be with us for a period of time, and the requirement for people to adhere to certain restrictions on daily life are likely to be with us for some time, and I mean years probably rather than months to come. So I think it's a really good observation, and I would share that anxiety at this stage.
Thank you, Stuart. I think we need to press on through this report. I know Trish has a question about the quadruple aim, which is, if we're taking the report in page order, would come next. And Katie Blackburn had a comment on waiting lists, I think. So if we take Trish's comment first, or question. Trish?
Hi. Yes, thank you for that. My comment was actually, or question is about the rate of hospital admissions with any mention of self-harm from children and young people, and noting that we're seeing just that we are seeing a slight increase, and I wondered what we're doing actually to understand this and to understand if it's how significant it is.
Yeah, thanks very much. I'm happy to start off. I'm pretty sure that Jamie or Alison would want to comment as well. So we know that sadly children and young people have been disproportionately affected by the pandemic, which is why it's key in our renewal priority. This is on a backdrop actually of increasing incidence of self-harm. Self-harm itself doesn't mean there's a mental illness, but it can, be a sign of emotional distress for sure. And our work as part of the sort of All Wales Together for Children and Young People programme, which I should declare I'm the chair of, and Mel Davis is a programme board member of, is really focusing on a new framework about to be issued, which is called NEST, which is really about the early help and enhanced support for children and young people and their families who may be struggling with emotional health issues in particular. And some of those are quite complex. So that work is a core part of the Start Well programme, which Alison Davis, Director of Nursing and Midwifery, co-chairs, and therefore it is a really important priority for us, Trish, moving forward. So the data is new, the data being represented, and I think there's still some queries about its completeness and what it actually is meaning for us, but we do know that self-harm is a matter of concern and forms part of that programme. I don't know, Al, if you wanted to add anything else.
Well, thanks very much indeed, Carol, and such an important point, Trish, to bring to the table. As was mentioned in our annual plan, children and young people's priority is really quite strong there. We need to be looking at things through quite a different lens. We're doing quite a lot of targeted work with one or two of our commission services to understand admission patterns for children and young people there. And as Carol mentioned, we've got the Start Well agenda that's really focused on this element. Plus we've had a very recent first meeting of the Start Well Junior Board. I think that will really give us some insight and start to help us see things from a children and young people's perspective. It was something that you touched on earlier. We've also got a commission in a children's framework, and I'm sure that we, as part of our priority for children and young people, will be looking at taking a more detailed look at admission and other service use pathways over the coming year.
Thank you. Are there any, Mel, yes, do you want to come back on that?
Just to say, and Jamie could probably add to it, we've got some really good membership in our mental health partnership as well, and particularly one young woman who really champions self-harm in this area. She has been doing some brilliant work. So there is a continuity across the Start Well into the Live Well Mental Health Partnership on this particular issue. Just sort of, so it's obviously an area from young children, young people, but also young adults as well. Sorry, Jamie, I hand over.
Jamie?
Thanks, Chair. Thanks, Mel. That wasn't my hand to say stop talking, Mel. That was my hand to say, can I put my hand up? I'm sorry. Yeah, no, I think my comment would be that I think Carol and Alison have reinforce that this would be a focus for us continually. I'm looking at the data on the report, of course it is for 1920, so I think we are very mindful as an entire collection of partnership of statutory and non-statutory bodies across Wales about the impact of the lockdown on children, and a focus on that data will be coming through now as we get to the end of this financial year. My inbox is a number of emails right now about emotional health and wellbeing. It's really an important topic. I think you're absolutely right, Mel. Our Engage to Change programme under the Mental Health and LD Partnership is very robust in that, and we continue to focus on conversations around this going forward. I think all we can reinforce is that we will need to be very close to the data, look at the numbers, look at the children that are involved in this and support them accordingly and their families, and think about any recurring themes and trends and additional support we can provide as we come out of this lockdown. I think there would be an emerging concern that people think that when the sun is shining, that we're out of it and it's over. I think we will need to make sure that we are very mindful of the longer term impact on families in general of the COVID pandemic as we come out of this into a different world.
Thank you. Before we move on from the quadruple aims, I've got a question on page 10 of 24 on that report myself, which is I wasn't sure whether the number of people with dementia over 64 has been reduced because of the failure of GPs to diagnose in Powys, or whether it's something we should be rejoicing about in that fewer people in Powys in that age group have dementia. It's not clear.
Yeah, Jamie might want to comment, but I can certainly offer a comment on that, Chair. There is a general calculation of what would be expected to be the number of people with dementia in our county, and we appear to be lower than that. The measure here is about GP diagnosis, and it's using a specific term, and I think in discussion with GPs around this issue, there is an indication that CT scanning is part of the, if you like, the evidence of which a firmer diagnosis is made. Yes. And so there's an issue about whether people are being referred and accessing CT scan, which we need to look at and ensure that our population has got a good access to that. Whether there's a judgment made about diagnosis rather than a firm diagnostic based on other factors because of the challenge and perhaps inconvenience of CT scan, and then actually the use of other terms, which may be terms such as cognitive impairment, which may be associated with dementia, but not as firm a diagnosis. Right. So there are a couple of factors in there that we will continue to work on. I think our practitioners are working on the basis of symptoms rather than always a definitive diagnosis, but we would recognise that having a diagnosis can assist a lot of people in their planning ahead, really. So it is an area we're going to have to remain quite close to and keep nudging up the firmer diagnosis.
Okay, thank you. I realised that COVID would have had an impact on that anyway. Thank you for that. Now, Katie, before we move on, because we will have to move on soon, you did have a comment, didn't you, on the lists, waiting lists?
Thank you, Chair. I just very quickly wanted to make a comment on behalf of the CHC, really, in that going back to Mel's reference to the reserve waiting lists, one thing that's been hugely successful, and I think unique across Wales really, is the ability for a carer or a relative or a counsellor or somebody else to complete those forms. Given the connectivity and demographics of Powys, we know sometimes online forms are challenging, but to think outside of the box and to allow other people to fill those forms in has been of huge benefit, and for which we are very grateful.
Oh, good. Thank you, Katie, for that. Thank you. Is everybody content then that we can move on to the financial performance report?
Chair, I think there were just two more quick. Yeah, I think there were just two more.
Sorry, yes,
ones.
I can see now.
Ian and Jamie. Yeah, thank you.
Jamie, do you want to go first?
Thanks, Chair. I wasn't sure who was going first. Sorry, when Katie mentioned the word list, I thought it might have been on waiting times. I just think as it's 31st of March, I should update where I can on the current position. Hayley's provided a lot of detail in the report and colleagues who wrote the report. But there has been positive progress, colleagues, against a rather large backdrop. So I think I can confirm that we have achieved no patients waiting longer than 36 weeks as a provider directly in Powys for cataract surgery. That is a fantastic achievement, bearing in mind the COVID pandemic and the pressures that are put upon us. I've said that's positive news. The challenge is, as an example of that, I'm not sure we'll maintain that in the coming few weeks and months, because what we've got now is that we have bulges in waiting in referrals. So during May and June of last year, very little referrals. That would have spiked up in September. Those patients are now coming towards what we call the end of the list, where they would be due for treatment. So either way, for the March period, we have done a fantastic achievement with excellent clinical leadership and the teams on site to achieve no patients waiting longer than 36 weeks for cataracts. As a provider, that's a good baseline for us to go forward. I think I can also say that our number of patients waiting over 36 weeks in total has dropped to 750, give or take, when it was as high as 1,470 in November. Again, you will see a dramatic improvement. Therefore, I take no comfort in the fact that it's still a long list, but I think it just shows the work that has been able to achieve in spite of the pandemic, and shows that, again, the teams will work very differently during the pandemic and expect to work differently going forward as well. So I just wanted to drop that information to colleagues. There'll be validation on that, but I think that shows that we still have significant challenges ahead. Colleagues have mentioned orthopedics and things like oral surgery. So I know Minister's been on television talking about 5 years. I don't see that being a Powys particular issue. I would be upfront on that, but we still have challenges in the coming couple of years, and we will be looking to work differently as multidisciplinary teams to support our patients and our referrers in a different way. I think also there's been mention of dental, my final comment, Chair, so I just want to pick up on that. I think it is a key topic and an unsolvable focus as a parent of 2 children myself. The data is from the Q2 of last year, so it's some period out of date. And of course, colleagues remember that up until June last year, we had the red status of dentistry, and services were fundamentally on a dramatic scale back. There have been improvements in recruitment into services in the period 6 months since, which will see help in Newtown and Welshpool, which are large, what we call NHS contracts. I just want to provide assurance that no child who's in pain or has a known dental need is refused access, and also our community dental services provides a safety net. There is work to be done to ensure that when a CDS patient is done, they will be recorded on the system by default on GDS to understand and help these numbers going forward. But this is a focus for us. Additional recruitment's in place, widening approaches on dental therapists to help children as well. No child in pain or no need will have been missed out and will be accepted. However, we just need to remind ourselves that this is about dental hygiene and oral health as well. So actually it is important to ensure that we work and focus on this in the coming year. The new contract reform that comes in October should help us as well. But rightly, this is a focus for us as a health board and our dental team with our contractors. Thanks, Chair.
Thank you, Jamie. Could we just please ask Ian to put his question in before we move on, please?
Yeah, sure. Just a comment and a question. One, I know we've said it before, but remarkable performance on the test and trace. I think they need to be congratulated by those figures. And the question was on influenza. It's my understanding that the risk of flu coming up this winter is increased due to the fact that we've all been socially isolating, and noticing that the healthcare workers' uptake is relatively low in my opinion. So are we targeting an improvement of uptake in staff due to the increase both to themselves and the people they care for?
Thanks, Ian. If I may, Chair, just take this question. So the data that's in the report is not the latest data, and I think it's been important to provide to the Performance and Resources Committee perhaps a bit more detail on this. The reason I suggest that, Ian, is you're absolutely right to alight on this issue, because vaccine uptake is a real opportunity to prevent illnesses. And given that we've got some concern about the coming winter period, I'm saying this at the end of March, I know that doesn't sound quite right, but the next winter we will want to absolutely maximise the uptake of all of the vaccinations that are available, be it for our staff or for our population. So I don't know, Stuart, if you want to give a comment. We usually have at the end of the year a bit of a what we call a wash up on the previous campaign, and obviously we use the latest data. So apologies that the latest data hasn't been available to present. But Stuart, would you like to briefly comment?
Yeah, thank you, Carol. I will. Just to pick up the last point first, you're absolutely right. One of the consultants, I suppose I should say, we're technically still in the flu season for this year. So although vaccination has by and large finished, the actual data collection around where we are at year end still isn't quite there yet. But one of the consultants in my team is putting together a briefing paper, as we do every year, to give a review of the 2020-21 flu season in terms of where we are. I don't have a full set of figures at the moment, but just for information, really, I was just looking at over 65s this morning and under 65s at risk. And actually this season we've seen a really good increase in uptake for those two cohorts. So Carol's right, the figures in the report you've got with you at the moment are a little bit historic. They're 19-20 full year, 2021 part year figures that I've had access to up until early March show quite a significant increase in uptake of flu vaccination for over 65s and under 65s at risk. So that's been really positive this year. The other thing to note on the flu season is if you follow the weekly surveillance data from Public Health Wales, this isn't very widely reported, but if there are rays of light in relation to COVID this autumn winter, you'll see that the incidence of flu this year has been really non-existent. We have not had a flu season this autumn winter, and that's partly down to the social distancing and the other measures that people have taken as part of COVID. So that's been a really one of the positive rays of light if we've had them through the second wave through the autumn winter. But Carol's absolutely right, we will do a year-end briefing on flu uptake across all staff groups, so we're working on that now, and we should have that ready in the next few weeks, and we plan to bring that in through committee structure so it can be reviewed and give a fuller explanation.
Thank you. I'm back, and thank you very much, Mel. I wonder whether perhaps we could move on, because we spent a lot of time on that. We needed to, but we also need to look at our financial report. So over to Pete.
Thank you very much, Chair. So you've all received the full finance report as included in the papers. This is the financial position as at month 11. So it's worth stating that we're on the last day of the current financial year. So my plan is to take through a couple of key issues and then take any questions at the end. So if I can refer you to page 2 of the report, as of month 11, we were £94,000 underspent for the year to date, and continue to hold our forecast position of break even at the year end. And we're anticipating to meet that break even position. As referenced earlier in the meeting, our total capital funding this year and total forecast spend is just under 6.4 million. I won't dwell on that because we covered capital earlier on in the meeting. If I can then take you to page 8, our current forecast spend in relation to COVID, both direct and indirect, is 26 million. So that's our total forecast spend, and that will be fully funded within our overall position. Those are really the key areas I wanted to highlight as included in the report. The usual detail is as included, including the latest versions of our monitoring returns as submitted to Welsh Government. So happy to pick up on any questions.
Right, questions, please. Are there any questions?
Chair, I'll take that as a positive comment that the financial reports are are easy to follow, contain all the relevant detail. I guess what I will say is that the themes in our reports has been consistent in terms of reporting to board over recent months and the various committees. So I know that people would have been cited on a lot of this information that we've discussed at previous boards.
Yes, exactly. And again, they are very clear. So Carol, did you want to comment?
Yes, thanks very much. And it's just to say that we have given the financial reporting particular focus, both for this year and for the year ahead, because in particular of the uncertainty of the environment and how really the pandemic has driven our costs and the way in which we've had to deal with issues in a very different way. I do want to just give a general comment really on the longer term outlook, and I think it's got to be one of extreme caution really, because you know, the country has been subject to a huge sort of financial shock, and you know, the government borrowing, etc., and you know, the pressure that there may be on public sector as we move through the next few years. So we have given that message to our senior managers in the organisation, so that even though we're in the here and now, there is a sort of an eye on the future, and I know that we'll want to come back to more detailed financial information for the future in due course. So I just wanted to give the indication that whilst we're dealing with short term, we are thinking about medium and long as well.
Yes.
Thank you.
Thank you, Carol. Salutary warning there. I think we have a question from Trish and from Mark. So Trish, do you want to go first?
Yes, thank you. The report is very clear and much easier to understand than formerly. But just to confirm that we have spent 26 million on COVID related support, and that is going to be funded by Welsh Government. Is that my understanding?
Do you want me to come in there? Yes, so Trish, absolutely correct. So the table on page 8 of the report, the grey table on the left hand side, details all of the direct and indirect costs of COVID. We've been through those items line by line in previous meetings. Yeah. For example, just to highlight one, Test, Trace, Protect includes the full cost for ourselves and the local authority for their element of that response. And yes, that cost and the funding is fully included in our position and included in our break-even forecast.
Thank you.
Thank you. That's good news for us anyway. And then Mark.
Thank you, Chair. I was just picking up on a point on page 9 in terms of opportunities. And it was just a question around the deliverable reduction in health board commissioning costs, and I was wondering what the sort of likelihood of that actually materialising is.
Thank you, Mark. So that is in that opportunity, the risk and opportunities in that table on page 9 clearly relate to this financial year, which we're on the last day, as I said earlier. That opportunity was in relation to the arrangement that's in place between NHS England and NHS Wales. So we're in a block contract arrangement with both our Welsh providers and our English providers, but there is a framework of tolerance around levels of performance in relation to NHS England. So at certain levels of performance, we do get some return in relation to our costs. There's some marginal benefit back to us. So that was a reference to that opportunity in that overall basis of the plan. That's one of the things that we've been managing as part of our opportunities against our risks as we get towards the end of the financial year.
Thank you. You happy with that, Mark?
Yes, thanks. It makes it a bit clearer to me as I was looking at it. Awareness that the block contract is in place, but I wasn't aware of that tolerance, so thanks for that.
Thank you. So we very pleased to note that, and thank you, Pete, and your team for the work you've put in throughout the year, and also for the very, very clear presentation that we now have of all these financial matters. Thank you very much indeed.
Thank you, Chair. Thank you.
Right, now, Rani, Board Secretary, over to you, the annual audit report.
Thanks, Chair. I'm happy to present the External Audit's annual report for 2020. This summarises findings from the audit work undertaken at the Health Board during the past year. Audit Wales have presented these findings in detail to the Audit Risk and Assurance Committee in January, and so I don't propose to go through that in a great detail today. But if I can just draw the board's attention to some of the key messages included, and they are that the Health Board's annual accounts for 2019-20 were properly prepared and materially accurate, and an unqualified audit opinion was issued, with no material weaknesses identified in internal controls. The Health Board maintained overall good governance during the COVID-19 pandemic, and that the Health Board adapted its financial control procedures during this time. However, there is an increase in risk to financial balance at the end of 2020-21. If I could just extend my thanks, particularly from Pete and I, to the Audit Wales team for the supportive and flexible approach that has been taken throughout the pandemic. The approach taken allowed auditors to meet their obligations, but took into account the pressures on our organisation during that time. I don't propose to go through any further detail, but I'm happy to take any questions.
Thank you. It's really good news. Very pleased. Thank you very much. Are there any questions? Right, so we can note that with some satisfaction. Thank you very much.
Thank you.
But that leads us then to the Corporate Risk Register. Again, that's you, Ronnie. Can I just check with you that we do have to approve something here? It's just not for noting. We need to approve the amendments or the changes. Is that right?
There's some proposed changes that the board are asked to support. Yes.
Thank you. So would you like to go ahead?
Thank you. So this is the March version of the Corporate Risk Register. There are some changes outlined within the paper for the board's consideration, namely that in respect of Corporate Risk 002, that regarding achievement of financial balance at the end of 2021, it is proposed that this risk be reduced from a possible to an unlikely risk occurring. And then 2 risks are proposed for de-escalation to Directorate Risk Registers, and those are Corporate Risk 11 in respect of a no trade deal, and Risk 15 in respect of South Powys planning and activity assumptions. So that's in respect of the Corporate Risk Register as it stands. I did just want to point out that a key piece of work for us now, particularly following agreement of the board's strategic priorities for the year ahead that has taken place earlier in the meeting, will be for us to review the risk register to ensure that those risks which could threaten achievement of our priorities moving forward are identified, assessed, and mitigating actions established. So I'm happy to take any questions, although I would ask that risk owners come in on any specific risks. Thanks.
Would anyone like to come in on that, please? Oh, Mel, have you got a question?
It's really, it covers both, I suppose. It's the earlier paper we had on the investment in the infrastructure of the estate, and the paper obviously in the risk register around our estates and the risk that covers that, especially with sort of regard to fire risks. Once we've done the works on the estates, I'm aware that our estate had a vast amount of work to be done on it, and I'm aware that the grants going forward will really improve our position in several different areas. Will that be enough to reduce this risk for the overall? I know it's too early maybe to ask that question. It's just that it's been on our risk register as quite a high corporate risk for a long time. There's been a lot of work around the fire risk and a lot of work around the infrastructure and the capital that's going to be put into that. And I'm just wondering if we are going to enjoy maybe a reduction going forward now in that particular area.
Shall I come in, Chair? Is that okay?
Yeah. It might be too broad and it might be unfair. But it's what's going through my head when we have these different parts and news about capital and, you know, that sort of thing. Thank you.
It's a really important question, Mel, and I think it's in the context of the extent to the backlog maintenance. So the latest report that we had is we've got circa £70 million worth of backlog maintenance across our estate. So although we're making progress in attracting investment, the scale is significant for us across all of the backlog that we're dealing with. But just wanted to reassure you that as we get investment, we are seeing backlog maintenance costs reduce when we do the work. But in terms of reviewing the risk register, we will do that on a regular basis. I still think it will be take us time to fully reduce that risk, Mel, but I think what we're able to show, and it's difficult on the corporate risk level, at the next layer down, you're seeing the risks reducing, but I think the overall risk, because of the scale of the backlog, will mean it will take us a bit of time to get there. But happy to provide again further detail and assurance on the detail that sits underneath that, maybe to the P&R committee, so you can see we're definitely coming down, but the overall risk is still significant because of the scale of the level of backlog.
Now, I wondered if that would be the case, but thank you very much for that explanation. It's just really interesting to know at what point we can influence such a sort of, I mean, it's a historic position that we've been left with, and we've been working away at it. It's just, it would be nice to shift it, but I understand that the sort of hierarchies of the risk coming through as well. So that's, it's nice. Thank you very much, Hayley.
Thank you. Carol, would you like to come in as well?
Yeah, thanks very much. I think, Mel, your question really was about risk 005 and risk 017. On 017, which is about fire, whilst estates are an element of that, I think progress has been made, and clearly the earlier report in which there is investment in fire compartmentalisation will assist. But there are some other factors that are putting that risk at that level at the moment, which are being dealt with, and that relates to issues such as site management arrangements, making sure that the non-estate matters are absolutely top drawer and we can have assurance and confidence that they work. Once we have tested all of that, I think we'll be in a position to reduce that fire one. But as Hayley said, the estate one is under quite a lot of review, and now with the investment in infrastructure, we can take another look at it. But we have such a long way to come on this one, I think. So it's very much in our minds, Mel. But we will, I hope, see a reduction in the fire one within the next few months.
That's lovely, thank you. I think the fire one's graspable, isn't it? We can get there. Yeah, thank you.
Thank you. Mark, you have a question.
Thank you, Chair. Yeah, it was around risk 016. Given the update that we had earlier from Chief Exec, I was wondering if that one, in the light of those notices, needed to be perhaps reviewed.
Yeah, thanks very much, Mark. The risk here largely relates to having a comprehensive assessment of where our prioritised big issues are. I think that the hand-on-arm vibration was a known issue to us. We were unclear whether there had been sufficiently strong assurances that we were on top of it, so to speak, and the HSE took the view that they wanted to see more done, which is absolutely fine. I would be in the sense of anticipating that actually once we are crystal clear on the prioritisation of the issues and risks, because some of them are known, the issues and risks that we have, we will be able to determine whether indeed it should go up further or even go down in terms of the level of mitigation that we've got in place. So I know that Julie is not with us this week, but Julie and Ronnie have talked about having more of that sort of risk map or assurance map that tells us what we have got where in terms of the health and safety elements, and therefore does the risk actually need to go up or go down because we're fully sighted and we're content that the mitigations are in place. So I completely appreciate your comment. Having an improvement notice coming in might think, oh, but we were aware of the haves issue. We just haven't yet fully satisfied the HSC that we have all the right assessments and assurances in place on that. So that one, again, Mark, is a very live one, both 16 and 17. And they're the ones that have come on more latterly over the last 9 months, I think. And hopefully both of those will have a review and assessment now, as Ronnie said, as we go into the first quarter of the new year.
Yes.
Thank you.
Thank you. Are there any more questions? Can't see any more. So are we in a position then to approve the proposed amendments set out in the paper? Thank you very much. Thank you, Ronnie.
Thank you.
Right, Katie Blackburn, Chief Officer of the Community Health Council. Would you like to speak to your report?
Thank you very much, Chair, and thank you very much for giving me the opportunity. I hope the report itself is fairly self-explanatory. There are just a couple of areas I think that might be of interest to members. Firstly, as you can see, we continue to be busy despite the challenges with community engagement and representing Powys patients on a number of different meetings, and that also includes making sure that we have got feedback from members of the public through our fortnightly meetings with members. We have weekly meetings with the health board, for which we're very grateful and appreciate how busy everybody is. We've got surveys as well that are currently ongoing. So although we're challenged, all of us, by the environment that we're working in, it's about doing things differently, as we've heard today. So we ourselves are doing things differently too. I think with regard to the advocacy cases, I just wanted to comment really to say that over 50%, if you can see from those figures on, I think it's page 3, are actually achieve local resolution, which is really positive percentage, and I just wanted to highlight that. I think it's also really important, I didn't raise it earlier, but Hayley mentioned, obviously had a long discussion earlier about planning and forward planning. Just for you to know that we are extremely grateful for the opportunity to feed into that planning process, and we too have found it extremely useful, and obviously it's an ongoing process. So you know, our thanks for that opportunity there. Trish came to the last full council meeting, and I've given the dates for all our meetings at the back, so members are very welcome to attend. Please feel free. We're actually getting more and more members of the public attending our meetings, which is great from that perspective, and I suppose it again is another benefit of virtual meetings and the ease of accessing them. But we had our full council meeting a couple of weeks ago, and I just thought it might be useful to highlight that at that meeting our focus was on mental health services, particularly those of young people, and we had the deputy head of Ysgol Moesydd Erwin from Gunlais who came and presented, and they'd actually undertaken some work and a survey amongst all of their young people, and it was a really fascinating insight. We had Joy there from a point of view of CAMS, Joy Garfitt from a point of view of CAMS and mental health services from the health board, but we also had representatives from Dewi looking at rural isolation and the impact on farming communities during COVID. So it was a very interesting session, and I just highlight that, I suppose, to make the point that we're aligning our priorities with your priorities, or the priorities that you have, and they are very much the same. Obviously, we wouldn't expect them to be otherwise, but it's about how we do align those and work forward over the next year. I think just wanted to comment. I'm sure you're all aware, but there was a ministerial statement last week about the Citizens' Voice body and about an implementation date of 2023, and that goes for the rest of that particular act as well, I think with one exception of vice chairs within NHS trusts. And just finally, we're looking forward to the CHC, looking forward to meeting with you all on the 27th of April, and that should be a very interesting and fascinating session. So I think that's it, Chair, from me. Thank you very much. I'm happy to take any questions.
Thank you, Katie. We're also looking forward to the board-to-board meeting. Trish.
Hi, just to say it was a really interesting meeting and I really enjoyed being there, but I think the work that was done by Mercy Therwin School with their students and about how the pandemic had impacted upon them was really interesting, and I think it might be quite useful to have that presentation circulated across the wider members, because you know we're actually listening to young people and what they're saying there. But thank you.
Thank you, Trish.
I'm happy to share that with Rani, Chair, for her perhaps to distribute.
Yes, that would be really good. Thank you very much. Any other questions? No? Well, thank you very much, Katie. So, yes, we look forward to our meeting in April. Pity it can't be a garden party, but never mind. Right. That brings us to the assurance reports from the committees. They're really for information, but just quickly, Carol, was there anything you wanted to say in particular about the executive committee?
Nothing specific to draw out, Chair. You'll see that we are across a number of areas, and just to remind that we do have topic-specific subgroups of the Executive Committee. So Quality Governance Group met last week, I think it is now. The Innovative Environments Group has met recently. Delivery and Performance Group has also met, and then a little while back, our strategic planning and commissioning. So our four groups there have met. We have tried in the spirit of streamlining to try to manage the business in as effective a way as we can without adding additional burden, and some members will be aware that we've got some work going on about how our future arrangements to discharge executive business are developed in order to try to maintain that streamlined approach wherever possible. So just going back to the very early comments of the meeting. So very happy to pick up any questions that arise from my report.
Are there any questions, Carol? No? Okay, so let's go on to Tony, please. Audit, risk and assurance. Any comments, Tony?
Thank you. Can you hear me?
Yes.
Okay. I'll be fairly brief. I'll comment firstly on the audit tracking recommendations. Obviously, we've had to reprioritise the approach because of COVID. We've made huge progress since, well, in fairness, Rani has driven forward the tracking very soon after she was appointed in post, and we've made huge benefits to the governance. In my view, of the health board, and it's worked extremely well. I thank her for that. The only other item I wanted to mention was the counter fraud exercise. It's a new team, and they've expressed some concerns about verification of various qualifications. So we're going to have a follow-up report on that. I know no more than what's already in this minute, unless anybody else can throw any more light on it. So we look forward to receiving that at the next audit committee. And I'll just mention my favourite topic of single tenders. Despite having quite a number, we're having no retrospective single tenders for the last couple of audit meetings, which is encouraging. And I think things are working very well in that area. I'll leave it at that, Chair.
Thank you. So any comments or responses? All right, thank you very much. Then it's the Charitable Funds Committee, which I chair actually, but Ronnie, do you want to mention anything? I think the important, perhaps the items to be brought to the attention of the board at the end are interesting. I would like to say though that it's a very, very lively, extremely interesting and dynamic committee this, and I thoroughly enjoyed my last two episodes of chairing. We did actually, I'm very proud to say, receive a substantial sum of money from the Captain Tom Fund. Delighted about that, and it's really lovely to see that it is actually getting out there to the NHS right the way across England and Wales. I don't know what's happening in Scotland, but certainly we are the very, very grateful recipients of what I think was £50,000 from that fund. So really pleased. Any questions? I think you'll see a lot more interesting stuff coming from that committee. We're soon going to have our own charity brand at some point, which will be exciting. Right, let's move to equality, experience, quality and safety. Mel.
Thank you, Chair. Really just to bring to the board's attention the scrutiny work that's been going on within the Experience, Quality and Safety Committee. The serious incidents and the concern reports have been still being scrutinised and looked at, and the inspections and the external bodies. Our mortality reports have been coming through the committee, which I know was an area of concern earlier to the board and has been highlighted, along with safeguarding, which we've discussed earlier today. I'd just say that the COVID-19 incident management report has been through and might be interesting for people to look at. And again, the maternity services report and the priorities around that for the health board and the work around that is also being looked at by that committee and considered in its fullness. And just to, at the very end, I would say about the commissioning assurance framework, that's back online. It's not as it was before. We know we're still in block contracts, but more information is coming through within that commissioning assurance again. So I'll just leave it at that. Thank you, Chair.
Thank you. Any questions? No, thank you very much.
Thank you.
Mark Taylor, Performance and Resources.
Thank you, Chair. Just a quick summary in terms of it's been a difficult year in terms of performance and performance metrics, but I think the executives have done a really good job in bringing what they can to us to give us assurance over that period, albeit truncated in many sort of national indicators, but I think positive as we go forward. One particular one for me was a report that Julie did for us on workforce performance. And I think what we see in the report is a need, I think, to have a discussion at a board level around some of the issues we've touched on earlier in terms of workforce input and how we structure our workforce going forward. So again, would welcome that board discussion, and that's one of the key points for me coming out of the report, which is there for people to read. Many thanks.
Thank you. Mark McIntyre, would you like to comment on that?
Yeah, I was at the meeting, Chair, and obviously the points that Mark raises are things that we reflected in our annual plan. We're aware of a need to kind of constantly look at our workforce as part of this on our risk register as well in terms of recruitment. So yeah, I welcome that discussion.
Thank you. Are there any questions? Good, thank you. So Carol, joint committees.
Thank you very much. Again, I wasn't going to say very much about these, but to say that during the second wave of the pandemic, the WISC committee dealt with only the absolutely essential items, and then just in the last month or so, really focusing on the plan ahead. So again, I think Hayley made mention earlier in the annual plan presentation of the connection to WISC here. Some important discussions around EASC that we will need to come back to, including the rural model of service delivery, and we've been really clear about the requirements of the service for our public. And then just to say, I don't believe the Mid Wales Joint Committee for Health and Social Care has met more formally since we met as a board. So just an overview of those matters. I do know that, in terms of committee work, I think Ronnie probably wants to come in on this point, really a reflection of the year that we're just finishing, and thinking about how committees work for the future feels quite important as we start this hopefully recovery and renewal process. What will we ourselves take from the last year, and when we're looking forward, what are the key areas we need to follow up? Mark's just alighted on workforce, for example, and I think our appetite and our ability has changed over the last few months about workforce, and there's lots of opportunity in there. So thank you. Sorry, Ronnie, did you want to say something?
Yeah, no, that's fine.
I think you've said it, Carol. But yes, we're very mindful of what we need to do about committees. So thank you very much. And the next then is the assurance report of the board's partnership arrangements, Carol.
Yes, thanks very much for that. So I think the partnership arena is one that has been both an absolute joy but also a challenge in the last year. In particular, if I can just single out the shared services partnership for a moment. Peter's our lead executive on that, and I think it'd be fair to say that the efforts of the NHS Wales Shared Services Partnership have been phenomenal through this last year. Their focus on ensuring that we've got PPE and other equipment for this pandemic, and their ability to work across all of the health service, and actually they've stretched further across social care as well, has been huge, as well as bringing forward a number of other items of business. And you'll see that in the executive committee report we talked about trams, which was a medication scheme, for example. So I would want to just point out the shared services contribution to our work. The other thing that I would just single out is the Regional Partnership Board, and just to say that we have been meeting as an RPB over the last few months. They've been shorter meetings, but they've been particularly focused on the priorities for the year ahead, hence the alignment with the annual plan. We've touched on children and young people a couple of times through the meeting, but that's incredibly important. And to indicate that my time as the chair of the RPB is now up, and I will be supporting the transition to a new chair. We are looking for nominations. I'll be writing out 2 members of the RPB for nominations for a chair. Just for the board's assurance, I will continue to oversee the senior sort of officers, senior executives group, because of the financial accountabilities that go with the regional partnership board. So, but you know, the partnership board itself has had a challenging few months in terms of trying to meet, but nonetheless, people have pulled out all the stops, and there is a clear plan ahead, and I think we'll be taking that to one of the board committees for more detailed review. Thanks, Chair.
Thank you. I think that's mainly for information, actually, but thank you. So that brings us to the last item. Well, almost, I hope the last item. We haven't had any notification of any other urgent business. So Mark McIntyre, then, the board's local partnership forum.
Yes, Chair, the report's just mainly for information, to give you an update about the last meeting of the partnership forum. I think The notes of the meeting from the 18th of March, I think, reflect the strategic issues that have been discussed today. So you can see that alignment. I think a couple of bits I just wanted to point out. The Chief Exec has done staff briefings on a monthly basis, and we've done additional briefings with the Partnership Forum because we recognise the importance of engagement at the moment. We continue to have as well weekly meetings with our staff representatives, and that's worked really well. But happy to take any questions, Chair, but nothing specific other than that.
Any questions? No, thank you very much. So was there any other urgent business? No? All right, thank you very much. Diolch yn fawr. Could you please then stay on screen or online while we wait for a short time to pause after the live streaming stops. But that does conclude today's meeting. Diolch yn fawr, everyone. Bye-bye. Thank you.
Bye-bye. Thank you.